A couple days ago, Representative Nancy Mace went on Bill Maher's talk show and stated that for pregnant women, they could potentially use ibuprofen for pain management. And she did admit that she's not a doctor and can't give medical advice. But the fact that she said that does mean that we do need a little bit of a lesson on why we're not supposed to take ibuprofen or other non-steroidal anti-inflammatory drugs called NSAIDs like naproxen, Aleve, and Motrin, and Advil, why you're not supposed to do that during pregnancy. Part of the way that ibuprofen works is that it inhibits the synthesis of a substance called prostaglandins, and that can have all sorts of effects during the pregnancy, and depending on when a mom is taking it during the pregnancy can have different types of adverse effects. It is definitely contraindicated in the third trimester of pregnancy because by inhibiting that prostaglandin synthesis, it causes premature closure of a blood vessel in the heart called the ductus arteriosus, which can increase the risk of the baby developing pulmonary hypertension, where the blood vessels in the heart have a high blood pressure, leading to the right side of the heart going into heart failure, and that is a major medical emergency for the babies. Also, it could potentially prolong a mom's labor because prostaglandins are needed as a part of the laboring process. There are many other potential problems when a mom takes an NSAID during pregnancy, like increasing the risk of miscarriage, decreasing the amount of amniotic fluid that's being produced. And so for these reasons, this is why acetaminophen, known as Tylenol, is the only safe and effective pain reliever, but also fever-reducing medication that a mom can take at this time. And if they're not taking those medications, especially for a fever, it can increase the risk of congenital anomalies as well. So this is a delicate risk-benefit discussion to be talked about with a doctor. And when politicians and influencers and celebrities talk about these issues, they're not able to discuss those nuances with you about why we have these types of medical decisions being placed.